Hello everyone and welcome to my YouTube channel. In this video, we'll be discussing an important topic that affects many pregnant women: bleeding during intercourse. While it's not uncommon for women to experience bleeding during pregnancy, bleeding during sex can be particularly worrisome. So, today we'll be talking about what causes this bleeding and whether it poses any risks to your unborn child. Causes of bleeding during intercourse during pregnancy. There are several reasons why you may experience bleeding during intercourse during pregnancy. Firstly, the cervix is more sensitive and engorged with blood during pregnancy, making it more likely to bleed. Secondly, the increased blood flow to the pelvic region during pregnancy can cause small blood vessels in the cervix to burst, resulting in bleeding. Lastly, the hormonal changes during pregnancy can also contribute to vaginal dryness, which can cause bleeding during sex. Is it dangerous to the child? The good news is that in most cases, bleeding during intercourse during pregnancy is not harmful to your unborn child. The baby is well protected in the amniotic sac and the cervix is closed, which means that the bleeding is unlikely to affect the baby. However, if you experience heavy bleeding or cramping after sex, it's important to contact your healthcare provider right away, as this could be a sign of a more serious condition. Risks to the mother. While bleeding during intercourse during pregnancy is usually not harmful to the baby, it can still pose risks to the mother. For example, heavy bleeding can lead to anemia, which can cause fatigue and weakness. Additionally, bleeding can be a sign of a more serious condition such as placenta previa or placental abruption. If you experience heavy bleeding or cramping after sex, it's important to contact your healthcare provider right away. Prevention and treatment. To prevent bleeding during intercourse during pregnancy, it's important to avoid positions that put pressure on the cervix. Additionally, using a water-based lubricant can help to prevent vaginal dryness and reduce the risk of bleeding. If you do experience bleeding during intercourse during pregnancy, it's important to rest and avoid sexual activity until the bleeding has stopped. If the bleeding is heavy or accompanied by cramping, it's important to contact your healthcare provider right away. In conclusion, bleeding during intercourse during pregnancy is not uncommon and is usually not harmful to the baby. However, it can pose risks to the mother and may be a sign of a more serious condition. If you experience bleeding during intercourse during pregnancy, it's important to contact your healthcare provider right away. With proper prevention and treatment, you can help to reduce your risk of bleeding and ensure a safe and healthy pregnancy.